Thank you very much indeed, Deputy Presiding Officer. I'm pleased to rise for my party to speak in this important debate, and I thank Jackie Bailey very much for securing time for it in the Chamber today. Deputy Presiding Officer, if you'll permit me, I'd like, as many of the contributions we've heard so far have done, to focus my remarks on the crisis currently facing our general practitioners. I was recently contacted by a group of GPs who work at a practice in my constituency. I know that others have had similar approaches, and one of them told me, and I quote, "Things in primary care are bleak. Everyone is simply exhausted, and working harder is not possible." Last month, that same practice received a letter from the SNP Green administration confirming a cut of £5 million in promised funding to Scottish GPs in this financial year. The government has blamed this broken commitment on budget pressures caused by inflation. Presiding Officer, that's also a slap in the face to our GP practices, as it completely ignores the fact that those practices are under the very same inflationary pressures themselves. They are getting it from both sides. It is also yet another grim case of this government playing games when it comes to announcing funding. The new figure was announced as part of the winter resilience package, giving the appearance that this was somehow new funding, when it is plainly a funding cut. And this week we saw the first frosts of winter. Cuts at this juncture will have a direct negative impact on the practice ability to meet the inevitable increase in demand that the cold weather will present. These cuts make it even harder for those heroic healthcare staff to provide the timely, high-quality care they so desperately want to provide. Presiding Officer, there has long been a workforce crisis in general practice, with a lack of GPs, practice nurses and other clinical staff. And, as we've already heard, 81% of practices have reported that demand is exceeding capacity, with 1,000 GPs needed to plug the gap. In 2017, the SNP promised to increase the number of GPs in Scotland by at least 800 over the next decade. Yet 5 years on, and the numbers improvement has been glacial. And it's the GPs who are forced to pay the price for yet more ministerial disinterest in that regard. With levels of burnout amongst the highest in the health service, and Lib Dem research has found that almost every single GP who is leaving the profession is retiring ahead of time, before the planned retirement date. And many others are leaving for other reasons, just at a time when we need them most. And who can blame them? Presiding Officer, our health service is being overwhelmed. And despite how many times the Cabinet Secretary denies it, SNP mismanagement set us on this course long before anyone had heard the word COVID. I mention again that Paul Gray, the former head of NHS Scotland, said that this crisis was inevitable, that COVID only hastened its arrival. The SNP and the Cabinet Secretary need to cut out the excuses, to stop abdicating responsibility and to get on with the day job. It is a damning verdict of the SNP's handling of the NHS that senior health bosses have even been discussing extreme proposals like charging for treatment. They are clearly alarmed at just how bad things have become. Presiding Officer, I do, however, feel duty-bound to highlight the intense hypocrisy in Conservative MSPs raising the alarm on threats to the NHS when Rishi Sunak is himself registered with a private GP practice which guarantees same-day appointments. And let's not forget, it was a Tory government that failed to take the NHS off the table during Brexit negotiations. It would seem that Scots currently have the worst of both worlds when it comes to protecting our most precious national treasure. Presiding Officer, it goes without saying that my party, the Liberal Democrats, are utterly committed to the core principles of our healthcare system, that it is available to everyone and free at the point of need. It was, after all, Liberal Democrats who brought free eye and dental checks, free personal care into Scotland. We're also committed to supporting... Well, in coalition with the Labour Party, we did. I'm in my final minute, I must say. We are also committed to supporting all of those on the front lines of our NHS. They have been asked to go beyond the call of duty for far too long. Their service warrants far better treatment than this. Thank you.
Thank you, Mr. Cole.